very good. I work in digital, so I love data, right? And it needs a lot of analysis. So I just want to set the stage here a little bit, right? Now, you're talking about safe medication, childhood cancer, all across, right? According to WHO, there are 51 million healthcare professionals in the world for 8 billion population, right? And they expect by 2030 to have a shortage of 10 million healthcare professionals. I think Dr. Narayanan may allude to that a little bit later. But what I'm trying to say here is, in Malaysia, our population is about 32.7, 32.8 million. We've only got 335,000 healthcare professionals, doctors, nurses, the whole gamut, everyone that you see, right? And that's why it goes back to Dr. Tay's slide just now, which was very scary for me to see when you have 28 oncologists in this country looking after childhood cancer, and you're talking about 40,000 something, of these patients around in Asia, right? We're talking about it just now. So it's very frightening in how to secure safe medication. It's all about the communication. We need to decentralize and train a lot of patients and the parents to advocate and speak to other parents as well. I was a bit upset just now when I saw that 5% of the patients are abandoning treatment, because every one of those, the percentage point is a life, right? And every one of those lives are extremely
They're not
important.
numbers, they are actual
Yes.
people, they are children.
Yeah, they're children. And they're parents who are going to lose their children, right? So that's important for us to stop that, just like what you were saying. And part of that is having these conversations with non-clinical people that are willing to come in and help you reach your goal. And I am glad to see your curve was going down, the number was going down, and you're saving more people. But how do we do that? Is by decentralizing a little bit, opening up the hospital mindset, by inviting the patients, the advocates, the parents in to have these conversations. Because one clear thing about Asia is we love all our traditional medicines. We love it, right? I mean, anyone who's any part of Asia is.
This is why this meeting is very important, and the role of CCI and patient advocates and NGOs is important in raising awareness and being the voice of the patients and the families, and explaining to them about safe medications, about abandonment, about access to care, about the possibilities. So this is very important. So Carmen, how about the Philippines and the situation of medications? Because now in this session we want to focus on drug access and access to safe drugs, and highlight the countries which have problems in our region.
I would just like to put our discussion on the bigger frame of access to medicines before moving on to safe medicines, just so that others who may not be involved in advocacy with regards to medicine would go away with this framework as well. We often speak of access to medicine in terms of our aids. Very important for patients and families, of course, is affordability. But then there is also now the issue of acceptability. For example, in the Philippines, we're able to access through canteens and through Indonesia as well, some medicines from there. But we still have doctors who are not convinced that these medicines are as efficacious are the ones that are in the Philippines. But the reason we do that is because from time to time, and I know that other countries in Asia have experienced shortages of methotrexate and martyrine. And so when it's not there, we call on our CCI members, especially candidates in India, shout out to you. But then the doctors say, no, you cannot use medicines from India. So that acceptability is become more of a political point. The other A in terms of access, of course, is with regards whether the government has already included it in the National Drug Formulary. We know a specific medicine that has worked very well and very quickly for certain type of childhood cancer, but unfortunately, while there are data already, in the Philippines, we still have to bring it through the back door, like somebody again coming from India or from another country, and then bringing it to the Philippines because it's not even in the list of compassionate medicines, and yet its efficacy has been proven. But we have now added a letter Q, and that's where the discussion of safe medicine comes in terms of quality. I think for a long time we knew that with other types of drugs, there was already not fake drugs, but substandard drugs. And this started because we have doctors who took it upon themselves to say, why is this child not thriving or getting better at the time frame that you have been describing? And then they find out that it has the same name, same packaging, but it's a substandard medicine. And I think that's why we asked that we have this discussion. We're happy WHO is here because we would like to now spotlight the fact that childhood cancer drugs are now at risk as well of having the substandard medication. And alongside that, because it will be your turn to speak, there's always been this perception that perhaps WHO, because of the leadership you have in the health community, could engage in market-shaping interventions. So there's not only more affordable, but as well, as was mentioned, safer drugs. Over to you, Ellie.
Thank you.
Challenging topic. It's not easy and it's very good.
Okay, let's put a few perspectives in order here. One, the essentials medicines and all actually does not fall under my unit. So I cannot sort of confirm or commit anything here. But let me put this straight. When we talk about strategies for securing safe medications for childhood cancer, this region is not, equal in terms of its resources in every country. Okay? There are logistical problems even in acquiring medicines. Now, it ranges from financial, goes all the way to the patient number. If a country is diagnosing 2 or 3 cancer patients a year, the government will not do a bulk order because it becomes a storage problem as well. They don't have the logistics for storing and all these things. And then it is not easy to buy a small quantity of medicine. So that's one side of it. The other side is when we talk about safe medications. If you had seen in my presentation, I did say that many of these countries don't have pediatric treatment guidelines. No pediatric treatment guidelines means you don't have a clue of what medicines are to be used. Right? So rather than just jumping straight like, how can we access this free, this safe medications, we need to look back. Right? We need to do a back casting kind of thing. Where is the problem? Why don't we have these free medications? It's not about anyone going to a country for treatment and getting the medication in and saying, okay, look, I've had 1 cycle back in India. How about you complete the remaining 5 cycles in my native country? When you don't have the people there who are trained in oncology, you don't have people who are even like pediatricians, for example, right? They don't have it. You don't have pediatric oncologists. You don't have oncology nurses. Many places don't have, oncology pharmacists for drug mixing and all these things. Okay? Proper suits for chemotherapy and all is not available. Okay, so we have to see a lot of things before we even jump of securing safe medications. Right? What's the point of having safe medication when you don't have a safe environment to give it? It becomes a liability. It becomes more life-threatening rather than life-saving. So there are a lot of logistical things that we probably have to look back into and then work our way up than just saying that we want to secure safe medications. So it's not that we should not secure safe medications, but we should do it in an appropriate manner. That can be looked back and said like, okay, this medication is something that is evidently driven. Clinically, there is evidence that this medication is an effective way of treating something. It is part of our national guideline. It is part of our essentials medicines formulary. And that way it becomes much easier to get the medications within reach of patients. Now, financial liability is another thing, like that is something that is very much dependent upon national governments, whether they are financing the purchase of medicines or is it the patient getting the medications in. Then there are, there has to be policies and regulations on, getting medications in as well.
You have highlighted the many problems that are the many steps in the actual problem. I will let Carmen make a comment and then I will.
And those are very good points and reminders for all of us here, many of whom are advocates in terms of access to essential life-saving and safe medicines, that even while we advocate for securing the safety of medicines, we don't forget the whole cancer care continuum, starting from diagnostics. And I just wanted to share that in the Philippines, we had a recent discussion with our Ministry of Health because they wanted to pour in more money into medicines, but not enough in terms of diagnostics. And the patient groups were the one that said, we appreciate that you now give value to having medicines, but if they are not diagnosed properly first, then the medicines won't even be there for them. And so as we advocate for securing safe medicines, let's put it in the context of the cancer care continuum. Both in terms of before you get the medicines, and then once you have the medicines as the good doctor, and as you were saying, the monitoring as well, in terms of the treatment and care and the impact. So really thank you for that reminder that it's really the whole cancer care continuum that we are.
And it's not only medication, it's not only chemotherapy only, because it's also pain medication, supportive care medication, antibiotics, antifungals, all these medications that go around the cancer treatment that make the cancer care safer. So if we want to summarize the problem in the big picture, if we want to secure good cure rates, good medication is not enough by itself. There is a continuum, which is making sure you have enough people trained in each country in Asia who know how to administer these medications. Make sure we have enough nurses, make sure we don't lose all the nurses and doctors. You know, in Lebanon, for instance, after the situation that happened, 30% of doctors, 40% of nurses have left the country to Europe and to other places. So there is the manpower that knows how to give these medications that we have to work on, the task force. The second part is lobbying with governments for acquiring a basic list of essential medications. So maybe we need to do a mapping of what is available already in each country and what is each country is doing, and how to help each other in certain resources. The third issue is production of medications in the region. Are we exporting all the medications? Are we producing? Is there a trust in the local medications? Sometimes among oncologists there is not a big trust among local production. Like you mentioned, the problem of India, who has good manufacturing, but sometimes there is a sense that they don't maybe trust as much in other countries or other governments that they are safe enough. So even if they are donated, sometimes there is not a positive response, which is something we have to work on in the awareness. Awareness among what are the safe places for production in the region, so we can become self-sufficient. Because if you produce locally, the cost is less, and availability is more, and access is easier. And this became, for example, a problem. I always give Lebanon because we had all these panel of problems happening. When there was the financial crisis, the drug companies could not import to Lebanon any medication. So we had a severe shortage, and you know that any delay in treatment can hamper the cure. So when there is no medication, the patients have to be sent home, come back for treatment, which hampers their cure rates dramatically. It's a big problem. So working on accessing medications was left for a certain period of time very up in the air. And some patients were getting their drugs from Turkey or other countries, and there were some fake medications in the market, including hemostasis medications, including chemotherapy that were not correct. And this is why we spoke about safety. Safety in terms of what kind of medications are the patients obtaining when they are left alone. So we as governments, as NGOs, as CCI should take charge of this problem and not allow I would say, the patients to have the responsibility of acquiring on their own these medications, which can be from unreliable sources. So how to control this, how to work on that, that is what I would like to hear from you.
I